Communication is essential for providing quality care to patients. When communication is lacking, patient can face errors due to patient-to-patient communication, patient and physician communication, and importance of overall communication. Oftentimes, we go to the hospital and have overnight visits. During this time, as patients, we see nurse-to-nurse communication pertaining to our personal health, or we see nurse-to-doctor communication. This topic is important to the audience listening to my speech because what if it is the audience getting accidental wrong care from nurses because information was not passed on to the patient about what was going on to the next nurse, or to the doctor to make sure correct care is being handled. I will be starting my Bachelor's of Science in Nursing at Goldfarb School of Nursing at Barnes Jewish College in the fall of 2023 to graduate with my RN BSN. While completing both my associate's degree and my bachelor's degree, I have a twin sister who has 1 year remaining in her BSN program to become a registered nurse herself. I will cover patient needs and the communication interactions at the time of the patient care. The communication between nurses and physicians and the importance of their communication, the last topic will be discussed is the better way nurses are able to communicate. Nurses face a lot of job dissatisfaction, which include a routine-centered care, lack of trust in nurse and patients, heavy workload, hard nurse tasks, nurse fatigue, and no time for patient interaction. Amongst these vital challenges nurses face is the challenge of communication. As stated by Osmond Williams Minor, communication plays a vital role on professional disciplines such as nursing care. Communication is a way for nurses and doctors to explain research to patients, have a positive health incline, better nursing emotions, and can help identify better aspects of care during time of need. Reflection of nursing skills in the process can lead to identification of difficulties and the recognition of possible solutions is especially important during SBAR, which is nursing shift change reports centered around patient care and often done bedside. Few articles actually focused on communication of nursing and patients, so having a better understanding on how the factors above play a role in healthcare can help nurses make job changes and techniques for higher care of the nursing industry. This article exploring PubMed as a reliable source for scholarly community services relates back to this information because it correctly identifies problems everyday nurses are facing besides the staffing of nursing in hospitals. While communication remains a top priority, it has many benefits. Nursing communication being improved can directly help the patient and can improve their personal care to make them live a longer life. This is important to discuss because it shows the importance of both the positive encounters and the communication between medical personnel that happens, and when done so correctly and smoothly, it could potentially be the reason a life is saved. When communication is lacking, it causes some discouraging harm to patients. This can lead to medical errors occurring because of mismarked body parts, misdiagnosed chronic illnesses, or because of administration of the wrong medication by nursing staff. While fear is stirred because of the errors this leads patients into getting in loops of not telling nurses what's wrong with them, or they don't know how to correctly explain their problems. We see a few steps with patients and nurse communication, but other forms of communication problems occur in the nursing field also. Healthcare professionalism in the intensive care unit, or ICU, being critical for high quality care. The readings aim to identify interventions that would improve communication between nurses and physicians in the ICUs. Nurse-physician communication has led to shortage of nurses in the hospital field and has also made the job of finding a replacement of nurses very difficult. To date, there is not an improved communication after the research conducted to help nurses and physicians in the ICU, where situations are often intense and communication needs to not be lacking. Which stated by Sarah at the University of St. Augustine, effective nursing physician communication has positive effects on the quality of patient outcomes, but such an increased patient portion satisfaction, shortened length of stay, and decreased adverse event. Sarah points out how positive communication affects patients directly both mentally and physically by shortening their length of stay. However, if a nurse finds a problem with the patient while doing a head-to-toe assessment, an RN's primary role responsibility, and doesn't communicate his or her findings to the doctor who will in return will miss something, the patient could suffer in the ultimate side effect of death. 7 studies examined by Maza Fairport, Sarah showed that the use of checklists and tools to enhance communication, including 2 team-building exercises, 1 on multidisciplinary structures, work shift review, and 1 on electric SBAR documentation template. This shows that effective communication is more efficient during shift change communication, which for nurses is SBAR, an acronym used to explain patient deals for patients such as situation, background, assessment, and recommendation. But are nurses only affected by nurse-to-nurse communication? No. We see nurses have had a high problem with patient communication, but now we can also help that see physicians are not good at treating nurses nice in the communication aspect as well. We can see communication skills between nurses and patient and nurses and doctors, but we can't find effective communication to further assess a nurses where communication often starts. The last article, The Importance of Effective Communication in Nursing, explained 10 effective communication skills for nurses. 10 skills were written communication, nonverbal communication, presentation skills, patient education, compassion, cultural awareness, personal connection, trust, verbal communication, and an active listening. The article, The Importance of Effective Communication in Nursing, states that encouraging patients to communicate by asking open-ended questions like, "Can you tell me a bit more about that?" This quote shows that the importance in verbal communication and how asking questions can be beneficial to help a patient open up while providing care. This may be done by having patients overcome different barriers while providing care to them, or for the nurses themselves. Overcoming barriers in nursing school is discussed, which explains that others might not take the meaning of a sentence which you perceive it as. The article goes to explain different examples of barriers, which include physical barriers, social barriers, psychological barriers. These barriers help nurses in several aspects. Social barriers help nurses learn to talk and patients and doctors directly and indirectly. Physical barriers is learning to talk to patients while assessing them during the head-to-toe process. And psychological barriers is the nursing aspect to give them anxiety that may have to process through their shift. Nursing communication is established as part of the education training, but it is also practiced a lot during the field of healthcare. To create a comfort environment, try closing doors, opening blinds, and mitigating outside noises whenever you can. Sarah goes to explain by this quote that communication skills include physical barriers. Physical barriers include closing the door for privacy, opening a blind, or deterring outside noises that might be distracting. This is essentially important if a patient is sidetracked and gets anxiety with what was going on. Too much anxiety in the environment could cause a huge problem with communication between the nurse and the patient, causing potential hazards. If the physical barriers become too stressful for the patient, being culturally competent and understanding communication needs between different cultures is a critical aspect of nursing. Different cultures have a different need, and the nursing job is to be culturally unbiased, aware of what was going around them. Having cultural awareness is important because the nurse can be a woman in a culture that doesn't accept women as their physician, so a male physician would be requested. This needs to be culturally explained and aware to the patient, doctor, and nurse. The topic I've chosen to write about in this communication is nursing and their interprofessionalism as it relates back to both between patients, communication between two nurses, between doctors, and other physicians that could be working with the patient. I have chosen this topic because of the clear importance that shows when communication is both there and not. Communication is the backbone of healthcare, and with it can lead to some costly errors. When communication is at its best between practitioners, patients will receive best quality care and they both deserve and want. When communication is lacking, patients will be the brunt end of the mistake made by words not being passed on or passed on incorrectly. Medical errors occur because of mismatched body parts, because of misdiagnosed chronic illnesses, or because of administration of wrong medications by nursing staff.